1, the intake. You are sitting in a plastic chair. The chair is orange. Everything in this room is orange or beige or the color of something that was white 20 years ago. The fluorescent light above you hums at a frequency that makes your teeth feel loose. You've been here for 4 hours, or maybe 40 minutes. You can't tell. They took your phone. They took your belt. They took your shoelaces. A man in pale blue scrubs asked you a series of questions you don't remember answering. Are you a danger to yourself? Are you a danger to others? Do you hear voices? Do the voices tell you to do things? You signed something, or someone signed it for you. A woman behind a desk stamped a form and you became a number. Not a name, a number. The wristband they put on you is plastic and white and tight enough that you can feel your pulse pushing against it. You are waiting for someone to tell you what happens next. No one tells you. Hours pass, and you realize that waiting is the first thing they take from you, not your freedom, your sense that waiting should eventually end. Level 2, the diagnosis. A doctor sits across from you. He has a clipboard and a voice that never changes volume. He asks about your childhood. He asks about your work. He asks about the last time you felt like yourself. You try to explain. You try to put words around a feeling that has no shape. You say, you've been tired in a way that sleep doesn't fix. You say you've been feeling like you are watching your life from the back of a theater. You say sometimes you can't tell if you are awake or still dreaming. He writes something down. He doesn't look up. You keep talking because the silence feels like a test you are failing. Then he says a word, a diagnosis. The word is clinical. It has 6 syllables. It sounds like something that belongs to a stranger. He says it like it is a fact, like the weather. You nod. You don't understand the word, but you understand that from this moment forward, everything you do will be read through it. You are no longer a person having a hard time. You are a case. You are a presentation. You are a set of symptoms that fit a code in a book. The word has replaced you. Level 3. The ward. They move you to a unit. The doors lock behind you with a sound that is not loud. The air smells like bleach and boiled potatoes and something older underneath. Something lived in that doesn't wash out. The hallway is long, and every few feet there is a door with a small window. Faces appear in the windows as you walk past. Some watch you. Some don't seem to see you at all. You are given a bed in a room with 3 other people. One of them rocks back and forth for hours without stopping. One of them talks to someone you can't see. One of them never opens their eyes. You lie on your bed and stare at the ceiling. There is a stain up there, shaped like a country that doesn't exist. You trace its borders with your eyes because there is nothing else to do. The lights go out at 9, but they don't go all the way out. There is always a dim yellow glow from the hallway that paints thin lines across your blanket. That light becomes your companion. You will hate it. You will need it. Level 4. The medication. Morning comes with a paper cup. You don't know what is in it. You ask. The nurse tells you the names of 3 drugs you've never heard of. She says they will help. She says it the way you tell a child that a shot won't hurt. You take the cup. The pills are small and white and they taste like nothing. You swallow them because refusing means something you don't yet understand but already fear. The medication changes things. It softens the edges of the world, but it also softens you. Your thoughts become slow, like they're walking through wet sand. Your mouth is dry. Your hands tremble slightly. You gain weight. You lose hours. You stare at a television in the common room. The plays shows nobody chose, and nobody watches. Days blur. You start to understand that the medication is not meant to fix you. It is meant to make you manageable. Manageable is the goal. Manageable is the product this place produces. Level 5. The hierarchy. You have been here 3 weeks. You have learned things they don't put in the brochure. There is a social order among the patients. The ones who have been here the longest have the most status. The ones who can do small favors get an extra blanket. Know which nurses are kind and which ones aren't. Trade commissary items for information. You learn to navigate this invisible map. You make an ally. A woman named Sarah who has been here since spring. She tells you which groups to attend and what to say in them. She tells you the words the doctors want to hear. Coping skills, grounding techniques, progress. She tells you that honesty is not rewarded here. Compliance is. You sit in group therapy and you learn to perform insight. You learn to describe your feelings in language that sounds genuine, but reveals nothing real. You are becoming good at being a patient. You are not sure if that is the same thing as getting better. Level 6. The visitor. Your mother comes on a Sunday. She sits across from you in the visiting room, which is just a cafeteria with slightly cleaner tables. She has brought a bag of clothes you didn't ask for. She looks at you the way you look at a house you used to live in. She asks how you are. You tell her you are better. You don't know if it is true. The word better has become flexible. It means you haven't cried in 3 days. It means you ate breakfast. It means you are surviving in a place that makes survival feel like an accomplishment. She talks about things happening outside. The neighbor's dog had puppies. Your cousin got engaged. The world you left is still turning, but it feels like a planet you've only seen in photographs. When she leaves, she hugs you too tight and too long. You watch her walk through the security door. You feel something crack open in your chest that the medication can't reach. Level 7, the release. They say you are ready. You've done the program. You've attended the groups. You said the right things to the right people. You sign more papers. You get your shoelaces back. You get your phone back. You walk through the same doors you came in, but in the opposite direction. The sunlight outside is too bright. The noise is too much. Cars, conversations, music bleeding out of open windows. The world continued without you, and it did not wait. You go home to an apartment that smells like absence. Your mail is piled on the floor. Your plants are dead. You sit on your couch and wait to feel free, but freedom is not a feeling that arrives on schedule. You have been trained to be a patient. No one trained you to be a person again. You have to figure it out alone. The silence in your apartment is different from the silence in the hospital. It is a silence you chose, but it is still silence. Level 8, the return. 6 months later, you are back. You didn't plan to come back. It happened the way a house fire happens. A small spark, then everything. You stopped taking the medication because it made you feel like a ghost. You stopped calling your therapist because you ran out of things to say. You stopped leaving the apartment. Then you stopped getting out of bed. Someone called someone. Now you are in the orange chair again. The same fluorescent light, the same questions, different nurse, same script. Are you a danger to yourself? Are you a danger to others? The second time is different from the first. The first time you were afraid. The second time you are something worse. Relieved. The hospital has a rhythm. The hospital has rules. The hospital tells you when to eat and when to sleep and what to do with the hours in between. Outside, you had to decide everything yourself, and you were terrible at it. You sit in the day room and watch a new patient being walked in. They have that look in their eyes. The one you had. You don't feel sorry for them. You feel envious. They still believe they're getting out. Level 9, the revolving door. It happens again and again. You become a regular. The staff knows your name. They don't even ask the questions anymore. They just hand you the forms. You've memorized your insurance number. You've memorized the medication list. You know which doctors will increase your dosage and which will just nod and refill. You have been in and out of these doors so many times that the hospital has become a second home, a more reliable home than the one you actually have. Your family stops visiting. They're not angry. They're exhausted. There is a limit to how many times you can watch someone you love cycle through the same story. You understand. You are exhausted too. But you keep coming back because inside these walls, your failure has a name and a treatment plan. Outside, it is just your life, and your life is too heavy to carry by yourself. Level 10, the home. It has been years now. You don't remember exactly how many. The medication, the good one, the one that finally worked. It takes some memories and blurs others. You live in a group home on a quiet street. There are 5 other residents. You eat meals together. You have chores. You have a social worker who comes on Tuesdays. This is your life. It is small, it is structured, it is not what you imagined when you were young, and the future was still a wide open field, but it is yours. You have accepted things you used to fight. You need help. You will always need help. That sentence used to feel like a prison. Now it feels like a key. You call your mother every Sunday. She answers on the first ring. Last week, you noticed an old notebook in your drawer. You opened it and saw handwriting you didn't recognize. It was yours from before. Pages of plans you never followed. A life you didn't live. You didn't throw it away. You put it back. You put it away. You are not that person anymore. You are someone who has learned to live inside a smaller life, and the smallness doesn't feel small anymore. It feels like something you built, brick by brick. Somehow, somewhere in the middle of all that wreckage, you built a home. The fluorescent light hums above you, but you don't hear it anymore.